So we're looking at a possible issue that women could actually come to the clinic to come and complain about. So this is excessive menstrual flow. Of course, this is the exact way in which they can put it, but everybody should know that this is the same thing that is called what? Menorrhagia. But those women might not know this terminology called menorrhagia. Do you understand? So they always say that, doctor, my menstrual flow, when it's coming out, it soaks a lot of parts. You understand? So what it just simply means is it's more than just a nuisance. It can signal that the woman has some underlying disease condition, and of course it's affecting the person's impact of life. All right, so that anytime she's menstruating, she can't actually go about her normal activities in a day because the blood is obstructing here and there. So what counts as excessive? All right, sometimes a person comes to you and complains that the bleeding is excessive, but you don't just agree with them. There are further questions you ask. Now these questions will help you to know if this thing was indeed excessive. So if she was bleeding for more than 7 days, if the bleeding was soaking through one or more pads, the bleeding normally shouldn't soak through a pad. It's a normal bleeding. This is what? Menorrhagia. Alright? If they are passing clots, if they are having fatigue, dizziness, shortness of breath, to show you that what? They are losing so much blood that they are becoming anemic. So causes to consider. What could make a woman bleed too much? You'll be suspecting things like what? Uterine fibroids, endometrial polyps, adenomyosis. They are all those, tumor growths of the, uterus, okay, ovaries and all of that. Endometrial hyperplasia or cancer, polycystic ovarian syndrome, okay. Systemic, that's issues from this one are gynecological issues, right? So issues from the whole body. It could be that the person just simply has issues with clotting. All right, that's your ability of your blood to form something solid to block bleeding. So it could be thyroid issues, could be liver or kidney issues. All right, it could be iatrogenic, that's medical related. It could be that the person is taking anticoagulants. It could be that the person is on some hormonal therapies. It could be that the person has some copper intrauterine device implantation. So you ask all these questions. So you also do further tests like complete blood count to confirm anemia, coagulation profile, because you want to rule out that the person doesn't have issues with their blood forming clots, thyroid function test, pelvic ultrasound, endometrial biopsies, just to rule out if there's any cancers. So treatment, you are trying to handle all those inflammation. All right, then you are trying to give them blood drugs that will basically clot the blood and all of that. So surgical, if you are having cancers there or tumor growths there, you have to actually hysterectomy, that's removing the uterus, and the endometrial ablation, you kind of barb up the endometrium. Then myomectomy. This way you are doing it because you want to actually cut off some fibroids that were kind of left there. So that's it for excessive menstrual flow as a complaint that patients could actually bring to you.